Greetings everyone, I am Kosi Sochi Chiwendu Amoha, Associate Professor, Department of Clinical Pharmacy and Pharmacy Management, University of Nigeria, Nsukka. I am here to present the findings of our study on the suitability of boarding secondary schools for students with asthma, an asynchronous online focus group discussion among members of an asthma awareness group. All co-authors are members of Asthma Awareness and Care Group, a subsidiary of the Respiratory Awareness and Care Enthusiasts Foundation. Nigeria has one of the highest burdens of childhood asthma in Africa, with a rapidly increasing prevalence. Acute asthma attacks in school children account for 2 to 10% of emergency hospital visits in Nigeria. This causes possible stigmatization through exclusion from school programs like sports and other physical activities. Despite these, some parents or caregivers lean towards the option of boarding secondary schools because they feel it helps children build independence, limits access to distracting technology, and provides an established learning community where these students can easily form study groups. This study was designed to evaluate individual perceptions and opinions regarding the appropriateness of boarding secondary schools for students with asthma, particularly in Nigeria. It also aimed to elicit perspectives about the facilities, appropriate training, and conditions that would enable the effective management of students with asthma in boarding schools. This qualitative study involved an asynchronous online focus group discussion among members of the Asthma Awareness and Care Group WhatsApp group. Data were collected using a structured protocol that was based on a case study comprising 3 questions. Data were analyzed using thematic analysis that employed framework principles. The vignette posted on the AACG WhatsApp platform was as follows. AB is an 11-year-old known patient with asthma. As the closest healthcare provider to her family, number 1, would you advise AB to go to a boarding school? Kindly justify your position. Number 2, what facilities will you advise boarding schools to have to cater to students with asthma? Number 3, should boarding schools simply reject students with asthma? That is, better safe than sorry? We received responses from 19 AACG members. Most respondents were aged 30 years and below. 3 main themes emerged from the analysis. Number 1, the appropriateness of boarding schools for children with asthma. Number 2, the facilities necessary for boarding schools to cater to children with asthma. Number 3, the outright rejection of children with asthma by boarding schools. Each main theme had sub-themes. For the appropriateness of boarding schools for students with asthma, the sub-themes were asthma severity and extent of control, child self-efficacy and assertiveness, child equipped with tools, school awareness, facilities and active support, availability of a guardian, knowledge and perception of teachers and schoolmates about asthma. To understand this clearly, it is important to match each sub-theme with the direct quotes made by some of the respondents. For instance, for the sub-theme availability of a guardian, one of the respondents did mention that if being in a boarding school is necessary, then it is okay for her to go. However, her parents would have to assign a guardian to check with her regularly. For the second main theme, facilities necessary for boarding schools to cater for students with asthma, the sub-themes were adequate and functional on-site medical facilities with round-the-clock availability of health professionals, effective referral system for severe emergencies, measures to minimize exposure to environmental triggers, dust, pollen, cold, collaboration and communication between parents, school guardian, and the child, training for staff and students to recognize asthma signs and help. Now, to understand this better, it's also good to match the sub-themes with the direct quotes made by some of the respondents. For instance, for effective referral system for severe emergencies, one of the respondents did mention that the school must be affiliated with a nearby hospital where they can rush the students to in cases of emergency like status asthmaticus. For the third main theme, outright rejection of children with asthma by boarding secondary schools, the sub-themes were never reject to avoid discrimination and stigmatization, reject if unprepared, better safe than sorry, accept even if unprepared but without liability to school, accept if prepared. Now, to understand this better, it's also good to match each of these sub-themes with the direct responses on the right of the slide. In conclusion, children's age, autonomy, asthma management status, and the school's readiness were identified as important considerations for the safe attendance of children with asthma at boarding schools. The references are below. Thank you for your time.